Thank you all so much for being here today. My name is Hillary Ritt, and I'm the Workforce and Adult Services Consultant with the Department for Libraries and Archives. Today's webinar, Kynectors, what are they and how can library staff connect, is the webinar you're in, and it's presented by Megan Snow. She is the Public Assistance Program Specialist with the Division of Family Support, Department for Community-Based Services in the Cabinet for Health and Family Services. So we want to thank the Institute of Museum and Library Services for sponsoring today's webinar and providing the funding for that. So thankful for that funding and so glad you all are here. And I will turn it over to Megan once I get her slides shared. And Tricia is putting information in the chat about captioning. Today's webinar is being recorded too, and so you all will have access to this in a few days, week or so, and so that is also something to be aware of. And then we'll talk more at the end about any recordings and so forth. If you have any questions, please feel free to put those in the chat, and we can answer those or address those at the end. And we're glad to have you here. Thank you so much, and Megan, take it away.
Good morning, everyone. I hope you're having a fabulous morning. It's raining here in Lexington, or at least it is on and off, so I hope everyone's staying dry. My name is Megan Snow, and I manage the Kynector program for SNAP and Child Care. So I like to have a little bit of a roadmap to see what we're going to be talking about today, and so that you know what we're expecting. I will give you guys a chance for questions at the end. If you have anything topical that comes up and that just can't wait, I will do my best to work it in. But if for some reason I can't, I promise I will hit it at the end for you. But today we want to talk a little bit about just a brief overview of the SNAP program, of what kynectors are, what they do, some additional information like how to reach a kynector, how to connect with someone, how to connect with kynector. I'm sure that you're groaning hearing that. And again, just some questions and wrap up. So just to give some very high level overview information about the SNAP program, SNAP benefits SNAP stands for the Supplemental Nutrition Assistance Program. This is formerly known as food stamps. You may have heard of it as food stamps in the past. SNAP benefits are for folks who that are income eligible. And if they are approved for SNAP benefits, then these benefits, the amounts will vary depending on the household situation. It's basically a ratio between household size, their income, and any qualifying expenses. That first initial month's worth of benefits is prorated. What that means is that if you were to apply for SNAP today on the 14th, it's a little bit less than halfway through the month, which means that if you were were approved for a SNAP, then you would receive a little bit more than half of the month's worth of benefits. That's why it's really important, if you have any folks that are interested in applying for SNAP, it's really important for them to go ahead and apply as quickly as possible. That image on the right is actually a picture of a Kentucky EBT card. So if they are approved, those recipients are going to receive an EBT card in the mail. It works like a traditional credit card at qualifying retailers. Not every retailer accepts EBT, but many, 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 many do. And those benefits are loaded to the card monthly. That date is dependent on the head of household Social Security number, so not everyone receives their benefits on the 1st or the 15th or what have you. Those SNAP benefits, like I said, the card works like a credit card or a debit card, and can be used on food items. They cannot be used on items such as prepared hot foods. You can't go through a McDonald's drive-through or get like a hot rotisserie chicken, or for non-food items such as, toilet paper, diapers, or alcohol, things like that. Now, for folks that are in more dire situations, there is something called expedited SNAP benefits. That is a matter of whether you qualify for it or not. But depending on the household situation, they may qualify for expedited SNAP benefits, which means they'll get their card and their benefits more quickly than the traditional application timeline. We're going to talk about that in just a moment. But just as a general, like I said, high level overview, there is something available for folks to get benefits quickly if they are truly in need. I want to pause for just a moment because make my presentations a little bit more dense than probably traditional, so I just want to apologize in advance. Like I said, I make these slides fairly dense as far as information, but I want these to be something that you can refer back to later on. So these are basically your notes as well. So afterwards, I believe Hillary has the slide deck available for you to download. And if not, then hopefully, is there some way that we can make the slide deck available, Hillary?
They will be available for download. I forgot to mention that at the beginning, but yes, these slides are available.
Perfect.
And actually the resources you shared yesterday with me too.
Fantastic, awesome. So as I said, then this is going to be available for download, and this should serve as your notes as well, because I recognize that if you're not familiar with the program, I've been working with the SNAP program for 12 years now, so I kind of live and breathe it. But for folks that aren't involved in it so often, this is probably like drinking from a fire hose. And so, you know, at least for me, if I have a lot of information thrown at me, I'd like to be able to go back and digest it little pieces at a time. So returning back to the actual content, let's talk a little bit about what SNAP eligibility looks like. So eligibility for SNAP depends on a number of different factors. These are the broad, again, very high level overview. We have like a 300 and some odd page policy document that gets into the nitty gritty of everything. So this is just giving you the briefest of Cliff's notes of what eligibility looks like. So eligibility for SNAP is based on, like I said, a number of different qualifications. These are the big ones. It depends on the number of people who are in the household. So these are folks who live together and who buy and prepare meals together. Something that is often confusing for folks who are applying for SNAP is that we have to list everyone who lives in the household. So if I had a roommate, but I was only applying for benefits for myself, I would still have to list my roommate as living with me, but I would not be requesting benefits for them. We also look at income for the household. Of course, this is probably one of the big ones that you expect to see. There's two major different types of income. It's categorized into two major categories. You have your earned income. Those are things like you're working direct hours for, so your traditional job, your self-employment, things like that, income that you are working directly for. And then you have unearned income, which seems almost insulting to say, but that's not what what we're going for. Unearned means this is income that you're not working directly for. So these are entitlements like unemployment or Social Security. It could also be things like if you have a friend or family member who is helping you out with your bills and giving you some money from time to time. There's a number of different things that we look at for unearned income. Pensions is also another one. After we have considered income, then we look at different expenses. This is that ratio that I was telling you about. We take a look at your income and then we kind of offset it with these different expenses. So things like if someone has rent or mortgage expenses, if someone incurs different utilities for their household, if they qualify for utilizing this expense, certain folks are eligible to get deductions for medical expenses and dependent care, so like childcare. And then beyond your income, expenses and number of folks in the home, there are some other technical eligibility factors. These are a little bit more complex. So as I said before, I want to leave this really high level and not overly confuse or overwhelm anyone. So we're just going to go just briefly over these. If you have questions about some of these things, because some of this is pertinent in today's news, then we can go over that separately. You can always email me and ask questions if you have questions later on. But we look at things like residency. Is someone living in the state of Kentucky, or intending to live in the state of Kentucky? Somebody could show up with their moving van and say that they just moved here and that they're intending to live in Kentucky, and that's enough for us for residency. We look at things like financial resources, such as your bank accounts, if there's any investments, that kinds of stuff. We're looking to see, where can someone kind of pool resources from if they needed to. There's this funky word called ABOD, which stands for able-bodied adults without dependents. And these are basically folks who are not with folks who are within a certain age range, who are not disabled and who do not have dependents of a certain age, those folks may have additional requirements like registering for work or work requirements to receive SNAP. This is the one that I'm really alluding to, as far as we're probably seeing this in the news right now with some of the budget bills and, you know, the big beautiful bill that's gone through. Some of those things have recently changed here specifically, which again, I don't want to get too much into detail because that could be a whole presentation in and of itself. We consider immigration status or citizenship, and then if there's any disqualifications, for example, if you are an ABOD or if someone is an ABOD and didn't meet their work requirements for a certain amount of time, then they are no longer eligible for SNAP until they do. Or for example, if someone had committed some kind of benefits fraud, they may be disqualified for a certain amount of time to receive benefits, those kinds of things. But that's something that DCBS considers and takes a look at, and anybody applying really wouldn't have to think about until we get to that point. So I'm going to pause for just a moment because that's a whole big chunk of information. Does anyone have any questions at this point?
Megan, I don't see any in the chat, but feel free to, folks, if you've got questions as are starting to digest this, please feel free to put those in the chat.
Again, I recognize that this is like drinking from a fire hose. I've worked with this information for over a decade, and I still have to go and look things up in policy to really understand them. All right, well, we're going to go ahead and move forward. If you think of anything, I like to say if you have shower thoughts later on, you can always send me an email and I'm happy to answer them. So this is going to be really where your work in libraries and in different resources, this is where we start kind of hitting the pavement. So if you have folks who are experiencing some kind of food insecurity, who are hungry, who need assistance in the nutrition standpoint, this is how folks can apply for benefits. There's a number of different ways. There's one, of course, that we're going to talk about the most because that's my program, but folks can apply in person at their local DCBS office. There's a link that's available in the resources for how to find your local DCBS office. Folks can apply over the phone by calling this 855 number. They can fill out or submit a paper application and submit that to their local office. And they can apply online via the self-service portal. This is something for folks that are feeling a little bit more tech savvy or comfortable. Then they can create a self-service portal profile and submit their application themselves. Or for folks who aren't feeling super tech savvy or who maybe just want a little extra help, this is really where we're going to be talking about the most today, is they can apply through a kynector who has access to the SNAP program. Kynectors are trained folks who can help with SNAP applications. And we're going to get into a little bit more of that information here in just a moment. But I highly recommend kynectors because they're really great for doing a little bit of that supportive work for getting through the process. I will fully admit, as someone who started taking applications in your local office and has moved to this central office role and has worked in a number of different levels in the SNAP process, SNAP is unfortunately one of those programs that is the government red tape. It's really, really hard to apply for. And so any kind of support that folks can get, like through kynectors, is always going to be helpful. But I'm a little biased, so take that with a grain of salt. So we've gone over just a brief overview of the SNAP program. Before we move into what kynectors are, again, I just want to pause and see if anyone has any questions. If you want to pop them in the chat, I'm happy to answer them now, or if you are still digesting, then we can keep moving.
No questions at this time, Megan.
Fantastic. We're going to go ahead and keep moving. If you think of something, go ahead and pop it in the chat. And like I said, I'll either get to it if I can while we're going, or we can talk about it at the end. So this is the bulk of why I'm here, is I want to talk to you about kynectors and what they are. So kynectors are essentially, they are trained folks working with different organizations, and they help families apply for SNAP benefits. I like to think of them as like a tour guide for getting benefits. They're showing folks the way, you know, how to navigate the program, you know, and get through everything. They have a slightly different version of that self-service portal, that online portal that folks can use to apply for themselves. Kynectors have a little bit more robust version of that to help submit applications. They're working with families to understand the process, to know what to expect next, and they're providing support on just you know, public assistance programs in general. Like I said, there's just so much to know about the SNAP program, and so they're kind of helping folks understand what's next. They can assist with a number of different programs. They can assist with Medicaid or qualified health plans, or they can assist with SNAP and child care, or they can assist with all of them. It just depends on the level of access that they have. My role in particular works with the SNAP and child care kynectors, and then there's a different team that works with the Medicaid and QHP kynectors. However, we work really closely together, so if there's ever a question, we can usually kind of bat it back and forth to whoever needs that information. So this is going to be maybe perhaps a little bit more information than you necessarily need, but I like to have full context when I'm looking at something. As I mentioned, there's a couple different types of kynectors depending on the access that they have. We have Medicaid kynectors, we have SNAP kynectors, and we have folks who are trained for both. And I'm not going to get into too much detail here because this is for kind of a high-level overview. You don't need to have the nitty-gritty details here, but essentially we have folks on the Medicaid side and the SNAP side who potentially are receiving funding through outreach or through contracts, and then folks who are, or teams, you know, organizations who are volunteer only, and then of course any combination of those in the middle. But just to give you some ideas of, there are some folks who are SNAP eligible, and there's some SNAP trained, some folks who are Medicaid trained, and some who are trained in both. At this point, many of our kynectors are actually trained in both at this point. So let's go ahead and talk a little bit about what particularly our SNAP and child care kynectors can do, since we're looking more at hunger and food insecurity. So our folks that are trained in SNAP, they can start applications and recertifications for SNAP and child care. So they help be the on-ramp to get benefits. They can look at correspondence and letters or notices that DCBS has sent to help advise on whatever those next steps are. This is another big one, is that they can help upload documentation. So if you have anybody, or if you've talked to anybody who's applied for programs, you know, they usually go to the local office to have their stuff uploaded or scanned, and sometimes that's a big trip. So having a kynector that can do that for you is really very helpful. Again, they've been trained in the programs, not to the extent of DCBS workers, but they've been trained in more navigation of the program, so they can help advise on how to navigate the SNAP program. They can explain what to do next, what expectations there are, and really how to, as seamlessly as possible, get through that process. And then they also are a great resource for kind of, I hate this phrase, but it's the best one I can come up with. They're really a great resource for boots on the ground education for things like EBT theft prevention, the changes to work requirements that's going on right now, that kinds of stuff. So they get educated on a regular basis with any changes that are going on, so that they can provide updated information to folks who have questions or who are trying to navigate this program. Now, they can't do everything, so these are some limitations as to what SNAP and child care kynectors cannot do. Big thing, first and foremost, is they can't complete a case. You may think of, if you've ever heard of kynectors before for Medicaid, they can apply for someone and potentially get them approved for Medicaid themselves. That is not the case for SNAP and child care. Because of our federal limitations, they have to go through, applications have to go through DCBS to be completed, because SNAP is a very precise program, And so there needs to be a lot of kind of review going on there. Also for SNAP and child care connectors, we track data for applications successfully submitted on the portal, but we don't have a lot of data for the other ways that connectors help, such as helping folks understand the program, such as uploading documentation, that kinds of stuff. Additionally, connectors can't submit changes to a case. What that means is that if somebody is already receiving benefits and they move, or someone moves in and out of their home, or they got a new job, they can't go to a connector to submit that change. They've got to go to DCBS to get that change taken care of. A narrow but very important distinction is that connectors can't advertise for programs. So they can't be like Girl Scouts selling cookies and go door to door saying, hey, would you like to apply for SNAP? They can't solicit applications. They can, however, advertise for their services. So if you've seen advertisements on particularly like KCTCS campuses, you might see, so-and-so is a connector and they can help with SNAP. That's okay. But they can't go soliciting applications for SNAP. And lastly, they can't apply for SNAP adjacent programs for things like the Simplified Assistance for the Elderly or the Elderly Simplified Assistance Program. Sounds like the same thing, but they are two different programs right now. But they can't apply for things like that or like disaster SNAP. So if you've ever heard of Medicaid connectors, then I wanted to go ahead and pop this up here. I'm not going to go into too much detail on this, again, just to not overwhelm you, but it's available for you if you really want to kind of dig into the nitty-gritty here. But SNAP and Medicaid connectors have similarities and differences. The similarities for SNAP is that they both take applications, they both upload documentation, they both provide support. The difference is that SNAP connectors can only initiate that application, whereas Medicaid connectors can potentially approve a case. Medicaid connectors can submit changes, whereas SNAP cannot. And one big distinction is that for Medicaid, you may have a dedicated connector. For SNAP, you may have a dedicated connector, but it's not on an official programmatic standpoint. You're not assigned, the same person every single time. So those are just a couple differences. As I said, I really don't want to go into too much because that's a little bit overwhelming for folks who are just getting there under them. So this is really, after understanding what connectors do, we're going to talk next about how to get in touch with connectors, how to utilize them for folks that are coming to your libraries, who are asking questions, who have needs. This is really what I wanted to highlight the most here while we're here. Before we dive into this, though, again, I just want to go ahead and take a pause and see if anybody has any questions that have come up before we go ahead and dive forward.
No questions at this time.
Fantastic. Either I'm doing a great job or everyone's very confused.
I've got some questions at the end, but nobody's put anything in the chat.
So there are two different ways that you can reach a connector. Thank you, Ronald. I appreciate you. There's two different ways to go ahead and get in touch with a connector, two predominant ways. There is the KHBE website, and there's the Connect Resources website. And I want to go ahead and give you just a quick overview on how to use both of those, and just so that you know what you're getting into. So if you have somebody that comes up and says, hey, like I really need some food, I'm having a hard time feeding myself or my family, then they may be interested in applying for SNAP. Now they can apply through any of the other means that they had that I listed earlier, but if you think that there's somebody who might benefit from having a little bit more support in the application process, then I recommend getting them in touch with the connector. So first thing that I usually recommend is to go to this KHBE website. This place is used to search for different connectors by location, and you can search by program. Now, this doesn't get somebody directly in touch with the connector. It provides contact information for that individual. Whereas the Connect Resources side, this is used to search for various community resources, to send referrals, that requests for somebody to make contact with the person that is needing help. So KHBE website is for somebody needing help reaching out to a connector. Connect Resources is to send a referral to have a connector reach out to somebody needing help. My little asterisk for Connect Resources, if you wish to send referrals, it also provides contact information. You can do that too. But if you wish to send those referrals to have basically a request for somebody to reach out to this person, you have to create a profile for your organization. So I would say for your particular branch, library branch. You'd contact that email address and they'll help get you set up. I lost my train of thought there for a second, but we'll go ahead and move forward. Oh, my train of thought has returned. Thank you. So Connect Resources, if beyond, I just want to go ahead and plug this a little bit. I know that KDLA has been working with Savannah Sublet a little bit. She runs the Connect Resources project, and Connect Resources is a great resource for you just in general, beyond just SNAP. It is powered by United Way, and it is essentially Google for different community resources. So if somebody is saying that they need legal assistance, or if they need housing assistance or childcare assistance, you can go to Connect Resources and search for the different organizations that are on there to see what kind of help somebody can get. I highly recommend checking it out. You don't have to have a profile to search it. You just have to have a profile to be able to send those referrals. So again, I highly recommend getting on Connect Resources and seeing what's out there. It's getting bigger and bigger by the day, and I'm really excited for the things that we can do with that. So we're going to go ahead and skip back a little bit to the KHBE website to show you just how to navigate this website. So first and foremost, once you log on to the KHBE website, or once you access it, you don't have to log on. Once you access the KHBE website, at the very top, there's a little section that says Get Local Help. You'll click on that and scroll on down to the second little chunk of text, and it asks for finding a connector. You'll click on that, and it'll give you a little search box to where you can search for, if there's a particular organization you know you want to work with, then you can search for the organization. But I recommend typically searching by county, by location. You'll search by county, it'll give you a list of connectors, and this is the biggest thing. If you take nothing else away from how to get in touch with connectors, this is the big thing, is that once you have those search results, you need to go scroll down to the bottom of those search results, and you'll see a list of qualifiers where you can filter the program. You'll need to filter by what program you need assistance with. Just because there are some connectors that are only trained in Medicaid and don't get SNAP training, or vice versa, there are some connectors that only have SNAP training that don't get Medicaid training. So that's my big takeaway, is make sure that you're filtering so that you're finding somebody who can help you, because there's nothing more frustrating than somebody needing help. You reach out to someone, you wait for them to respond, and when they respond, they go, sorry, I'm not trained in that, I can't help you. So we're trying to be as efficient as possible and make sure that you're filtering by program. Then let's go ahead and take a look at Connect Resources. Again, we're going to do just a very high-level overview here, simply because it requires getting that profile to be able to submit a referral. But on Connect Resources, you can search by organization if you know a particular organization. For example, Feeding Kentucky is a very large organization in Kentucky that has a number of different food banks all across the state. You might search for Feeding Kentucky and see what different contacts there are. Or you can search by resource. What they mean by resource here is what type of help you need. So it might be food, it might be legal, it might be housing. You would search by resource if you're looking for kind of the broad strokes topic for what you're looking for. Once you find that organization that you're looking for, then you would click Connect, on the right-hand side of that particular organization, and it'll bring up a little box that allows for entering contact information, that kinds of stuff. My one takeaway for this is make sure that you're entering contact information. Something that Savannah tells me on a regular basis is that there are lots of folks who submit referrals and they just put, Jane Doe, somebody's name, and don't have contact information. So whenever an organization receives that referral, they go, oh great, Jane Doe needs help. I have no idea how to get in touch with her. So make sure that you're putting in contact information if you're utilizing this resource to send referrals. You'll hit submit, and that sends it off to basically an inbox for that organization where they can check off who they've contacted, and allows us to have some data on referrals, that kinds of stuff. It's really your choice. You'd like to go ahead and just reach out to a connector directly, or if you'd like to have this referral sent. It really depends on really how much you want to get into as far as resources or the KHB website. So, again, I know I'm sending a whole bunch of information at you. So this is just the Cliff Notes of how to access both, just side by side. Now, this is my little pitch for connector organizations in general. If you are interested, if your branch is interested, or if you work with a nonprofit or compatible organization, we are always growing. I am always happy to add more organizations to our ranks. So we have a number of different types of connector organizations. They all tend to be either non-for-profit or government organizations. We cannot have any kind of for-profit organizations joining just based on our federal requirements. If they have a compatible mission, which is really easy to justify. So, if you're working with legal aid and folks are saying that they're having a hard time feeding themselves and that's part of their process, then we have Kentucky Legal Aid as one of our organizations. If you work for a church and you're saying you're trying to help folks, feed their families, then that's a compatible mission, that kind of stuff. So again, really easy to justify. And then if you've received training, which I help you with the training process, then if you have yourself as part of your branch, or if there's a nonprofit you're working with, if you wish to become a connector organization to actually submit these applications yourselves, you are welcome. You are so very welcome, and I would love to have you join us. Or if you work with an organization and you think they might be a good fit, please have them contact me, because I would love to have them join us. The more access that we have, the easier it is for folks to receive benefits, the easier it is for folks to navigate benefits. So, it is a fabulous program, and I would really love to have more folks join us. Now, I recognize that for library staff, you guys are working extremely hard. You are probably overtaxed with the amount of stuff that you're working on and the ways that you want to help. You guys are really, being so helpful for communities. So there's no pressure. If you don't have the bandwidth or the time or the resources to become a connector organization, that's fine. You can send your referrals through Connect Resources, or you could have folks contact connectors through the KHB website. But if you have the space, if you have the time, or if later on down the line, if you have the time and the resources to become a connector organization, you can always contact me, and we can always work you through the process to become an organization. So that's my little pitch is, if you would like to, or if you have questions, you can reach me here at this email address right here at famsupportconnectors@ky.gov. That reaches me. I'm the only one that's on the program inbox. So you're still reaching me, but it's just a little bit more of continuity for the program. So I feel like I've buzzed through this really quickly, and I apologize if I spoke far too fast, but that's the overview of what connectors do, a brief overview of the SNAP program. And at this point, I want to go ahead and open it up for some discussion. If you guys have questions, if you just want to kind of talk about, what's out there, if you need to brainstorm how to make this work for your particular location, we have the time to do that.
Megan, thank you. So this is Hillary. Thank you so much for sharing this information. And I've put lots of links in the chat, things that you had already shared with me, and then some of the other things that you touched on. I don't see any questions yet, but I've got a few of my own, so I'll kind of start the discussion off
Absolutely.
if that's okay.
Of course,
Snap,
of course.
the SNAP application that you referenced early on, is that available in any language other than English?
It's available in, I want to say, the top, most of our written correspondence, like forms, applications, that kinds of stuff, they're available, I want to say, in the top 5 languages in the state. So it's usually like Spanish. Um, I want to say we actually have it available in Swahili.
Mhm.
Um, I don't know the specific languages off the top of my head, but yes, we have them available. Especially, almost everything is available in English and Spanish for sure.
Sure.
And then beyond that, we have a number of different other languages. We also work with um, our language line. We have a language department that if
Yes.
there's anything specifically that we either need to have translated, or if we start seeing some data to support that we're seeing a higher prevalence of certain languages, then we can start working toward getting certain things translated on a regular basis for those things.
That's, thank you. Wow, that's great to hear. And
I
you,
do also want to take it one step further too. If you're
sure.
calling the SNAP hotline, that 855 number, to apply for SNAP benefits, we work with Language Line, which are live translators. So that's almost any language that they have available. So that's just a one-for-one translation during the application process. But folks should certainly feel encouraged. They can contact DCBS, and we have somebody available that can help translate.
That's encouraging to hear too. So if a library staff member decides to get trained by you for to become a connector, and someone comes in and it needs assistance but does not speak English, and our staff member doesn't speak English, I mean doesn't speak the language of that patron, there could be the
Mhm.
potential for connecting with that live language translator or other potentially assistance. And
Yes. Yep.
okay.
I do want to. So that's, well. If you have somebody who is interested, if you have a branch that's interested, or library staff that are
Hmm.
interested in becoming a connector,
Hmm.
we'll talk about this in a little bit more depth. There's a little bit of nuance as to when connectors, when and how connectors can contact DCBS to
Okay.
help their clients.
Sure.
Connectors are not considered authorized representatives, so for SNAP they can't contact DCBS on behalf of their client, but there have been many instances where a connector will contact DCBS alongside their client just to kind of help, um, you know, understand what DCBS is asking, that kinds of stuff. Not from a language translation aspect, but more from a process translation aspect.
Sure, sure. Thank you for that clarification and
Yeah.
nuance. Um, Even if library staff are not able to, or at this time, become a connector, or that's not something they're interested in, but they want to maybe collaborate or learn about collaboration opportunities with ECBS, with SNAP, what opportunities exist? Like what would the process be? So maybe they want to have a connector, maybe there is a connector in the community already, and they want to have that connector come to the library, or what opportunities to collaborate could exist?
I mean, endless, really. So the connector program, particularly for SNAP, is quite flexible as far as how we administer it. It's a very new thing for uh, the country as a whole. There's a very few number of states that actually offer something like application assistance for SNAP. Um, so we don't have a ton of restrictions on us as far as what we can do. So I'm happy to, if there's a particular branch that wants to, or a particular staff that wants to discuss something in specifics on how they want to make this happen, I'm happy to discuss that. But like you said, opportunities could be something like, we can get you in touch with a connector that's already established, and see if they want to come out and have, Tuesdays they're available, from this time to this time to take applications or something. There are plenty of connectors that'd be willing to do that kinds of stuff, and I could help broker that conversation. Um, it could be a matter of, I know particularly for the Medicaid connectors, they're required to have attend a certain amount of community events. And so if there is a need for healthcare, then especially during like open enrollment and whatnot, having events of like a application or something event in in the afternoon or evening when folks are if their folks are working, that they can make it at different times. That's another opportunity. So if it has to do with Medicaid, I can again just kind of make that connection. But there's really ultimately it's to the extent of how creative you can get. Another way to support if without being a kynector yourself is if you have folks who are needing to call DCBS to do their interview. An interview is a required part of the application process, and I know lots of folks are limited with their minutes on their phone or even battery life, that kinds of stuff. And so if you are library staff that have some semi-private rooms or cubicles or something where you can have access to a phone for folks to contact DCBS and do their interviews, that's another way where you could help without actually being a kynector yourself.
Thank you for all those ideas. And I think we would be, I would be happy to facilitate an additional meeting with Megan if your library's interested and you just want to brainstorm ideas. You can email me and I'd be glad to talk with you. I'm kind of going, this is a little out of the scope, but that's part of what I'm here for, is to help libraries get connected with state and local resources and to help brainstorm ways to help you and your community. So that's certainly something I would be willing to do as well. What if somebody's interested in being a kynector, but they wonder about, oh, what if I make a mistake? I'm human and I'm scared I might make a mistake. I know that you offer training, but how would you address that?
So a couple different things. There's a lot of protections in place for kynectors. Again, kynectors are truly there to help support both applicants and DCBS, because we just have a really large volume of folks who need services, and only so many DCBS workers that can get through it all. I know it used to be back in the day. It used to be that DCBS workers did a lot more of that supportive work as far as understanding how to process or how to navigate the process, that kind of stuff. And simply they just don't have the time to do that anymore. So kynectors have they have some protections in a couple different ways. One is that they do receive training, so you're not going to go in blind with taking applications, that kinds of stuff. Two, because they're not authorized representatives, they're not taking action on behalf of their clients, that they're working alongside their clients. You're not assuming any kind of risk or liability, unless it's like you're obviously trying to defraud the program, which I don't think anybody would go through the process of becoming a kynector just to go ahead and submit willfully wrong information. So there's that, that you're protected by not being an authorized representative. The last thing this is the biggest part that I really want to assure folks, is that you're trying to help gather as much complete information as you possibly can to submit for an application. But ultimately, that is so that you're basically giving DCBS a leg up to start that application. You're giving them more information to get started with, so that when they take the football, that they can run with it, and you've already passed it down the field. This is a really terrible metaphor, and I really regret getting into that one. But all you're really doing is you're kind of giving them a head start. So ultimately, if you have something that's not quite right, or you're not sure how to enter something into the system, what you're going to do is you're going to enter in something to the best of your knowledge and ability with the resources and information that you have. Because also, when you're talking to a client, they may have a different understanding of how certain things count, that change when they actually have an interview with DCBS. That's my point being, is that when you're submitting information for an application, you're not the last person to touch it. DCBS is going to go through it with a fine-tooth comb and kind of smooth everything out that you've submitted. Again, you're really just giving them a quick head start to keep moving the process forward a little bit more efficiently than starting from square one.
Thank you, Megan. That all those points, that was very helpful, and for breaking that down. So what other questions do folks have? I know that some of you all have worked directly with your patrons, and that there is food insecurity in some of your communities. And do you have questions that for Megan? We've got a few more minutes. And I'm going to actually put in the chat, we had a webinar last year related to SNAP that's called SNAP, What Is It, and how it can help library patrons. I'm going to drop that in the chat. One of Megan's colleagues, Amy Smith, was presented that for KDLA, and so just want to share that with you as well. Any questions that folks have? How long is the training?
Fantastic. Ronald. Training to become a kynector for a new organization in general is typically, it takes about a month or so from the time that the organization is approved to being ready to go. And that month is only, let me kind of offer some nuance. The month-long process is to onboard new organizations, and that's mostly because we have to go through an MOU process to kind of have a little bit of legal protections for everyone, as far as making sure that you're getting access to our system, and you're not going to intentionally defraud anything, and also so that you kind of know what your left and right limits are. For an individual kynector, there are, there are 2 online trainings that you take. It is self-paced, but they cover the application process. They cover a little bit about civil rights, a little bit about avoiding unintentional bias, and then there's one about just privacy and security for the information that you have available to you. You could complete that in an afternoon. So once your organization is onboarded, to actually onboard individuals to your organization, if they have enough time to dedicate to it, they could get it done in an afternoon.
Great, thank you. Well, I'm going to put a survey link in the chat. This doesn't mean that we have to stop this conversation, because Megan has shared some